Cataracts is an opacity of the lens in your eye. We all have a lens that sits in the middle of the eye and it's used to focus light. So just like a camera has a lens, we have a lens in the eye, and that lens again becomes opaque over time, and what happens is you can either get white focal opacities that occur in the lens, or you get a change in the color of the lens where the lens in the eye can become yellowish, brownish, or even become completely white. And those opacities cause blurring of the vision either at distance or near. So there's several symptoms that patients will develop with cataracts, and it's a gradual process, so most patients don't realize it at first. But initially the first symptom can be glare at night with headlights. So as you drive at night, you suddenly seem to think that most patients have their brights on when they don't, or you might have more difficulty seeing things at nighttime, or there may be a ring or a halo around lights. The other thing that patients will start to notice is that sometimes their distance vision just doesn't seem to be as clear, even in the daylight, as it used to be. There's several different reasons patients develop cataracts, and cataracts typically are just a sign of aging. So anyone above the age of 50 is going to have the beginnings of some form of a cataract. The key is whether or not they're significant or not. And so patients who typically develop significant ones become older in their 60s or 70s, and it's a protein buildup from just time. Also, UV light can cause the protein to build up in the lens more quickly, or discoloration of the lens. Other causes, identifiable causes, could be trauma, steroid use for medical conditions, and then diabetics often will get cataracts at an earlier age. Treatment for cataracts can vary. Initially, patients whose vision is good enough to pass a driver's test, you can usually get by with a new prescription in your glasses with an anti-reflective coating to help with the glare conditions. However, once the vision drops below driving vision, or the glare becomes so significant that patients can no longer drive at night and feel safe, the only option is cataract surgery at that time, where we remove the cataract and replace it with a new clear artificial lens. So cataracts, again as stated, are something that happens to all of us. So it's nothing that particularly someone's done wrong, and so we're all going to get it at some point. And to set patients' mind at ease is that cataract surgery is the most common outpatient surgery performed in the United States. So the technology has caught up to the 21st century to where cataract surgery is definitely one of the more cutting-edge procedures done, and it's typically a 12-minute procedure that can be done as an outpatient same-day procedure. And so things to look for in a surgeon to help with your cataract surgery and set your mind at ease is you should have a surgeon that is familiar with the modern technologies and using the latest equipment. We have lenses that are out there now that actually correct for distance and up close. They're like having bifocals in the eye. We also have new cataract lenses that help fix astigmatism. So if your doctors typically are using and aware of this technology, usually you should be up to date with the latest technologies.